Today, we will embark on an in-depth exploration of various topics in radiology, specifically focusing on the intricate details and complexities of spinal imaging. Radiology plays a crucial role in the diagnosis and management of spinal conditions, enabling healthcare professionals to gather essential information for accurate treatment decisions. In this comprehensive script, we will delve into 12 captivating topics that cover a wide spectrum of spinal pathologies, imaging techniques, and interventions. Through this script, medical students will gain a thorough understanding of the fascinating world of spinal radiology. Ankylosing spondylitis is a chronic autoimmune disease primarily affecting the axial skeleton, particularly the sacroiliac joints and spine. Radiographic findings play a vital role in its diagnosis and monitoring disease progression. Key imaging modalities for assessing ankylosing spondylitis include conventional radiography, magnetic resonance imaging, MRI, and computed tomography, CT. We will explore the characteristic radiographic features, such as syndesmophytes and sacroiliitis, and discuss the clinical implications of these findings. Diffusion-weighted imaging, DWI, has emerged as a valuable tool in the evaluation of spinal tumors. DWI exploits the random motion of water molecules and provides insights into the cellular density and microstructural integrity of tissues. By assessing the apparent diffusion coefficient, ADC, values, radiologists can differentiate between benign and malignant spinal lesions, aiding in their characterization and treatment planning. We will discuss the principles of DWI, its role in spinal oncology, and highlight several illustrative cases. Radiology plays a pivotal role in the management of spinal cord injuries, SCI, providing essential information for initial assessment, surgical planning, and long-term monitoring. Modalities like radiography, CT, and MRI are used to evaluate spinal stability, fracture patterns, spinal cord compression, and associated soft tissue injuries. We will delve into the classification systems utilized for SCI, discuss imaging findings that guide management decisions, and outline the role of other advanced imaging techniques in this challenging clinical scenario. Spinal epidural abscess, SEA, is a rare but potentially devastating infectious condition that requires prompt recognition and intervention. Imaging plays a crucial role in its diagnosis, with MRI being the modality of choice. We will explore the typical imaging characteristics of SEA, such as spinal cord compression, paraspinal collections, and associated epidural enhancement. Additionally, we will highlight the importance of early surgical drainage and antibiotic treatment in optimizing patient outcomes. Bone tumors affecting the spine encompass a diverse array of neoplasms, ranging from benign to malignant. Radiologic imaging, including radiography, CT, and MRI, plays a vital role in the characterization and staging of spinal bone tumors. We will discuss the radiographic features of common primary and metastatic bone tumors, emphasizing their distinct imaging patterns and the differential diagnoses to consider. Moreover, we will touch upon interventional radiology techniques used for diagnostic biopsy and therapeutic interventions. CT myelography is a specialized imaging technique used to provide detailed visualization of the spinal cord and nerve roots. By combining intrathecal contrast administration with CT imaging, this modality enables exquisite delineation of the spinal cord, nerve roots, and associated pathologies. We will discuss the indications, technique, associated risks, and interpretation of CT myelography, emphasizing the advantages and disadvantages compared to other spinal imaging modalities. Magnetic resonance imaging, MRI, reigns supreme in the evaluation of lumbar disc herniations, offering exceptional soft tissue contrast and multiplanar capabilities. We will delve into the various imaging findings associated with lumbar disc herniations, including disc morphology, disc degeneration, and associated neural compression. Special attention will be given to differentiating between disc protrusion, extrusion, and sequestration, as well as highlighting the clinical and surgical implications of these findings. Spinal hemangiomas are commonly encountered benign tumors of the vertebral bodies, often incidentally discovered on imaging studies. These lesions typically exhibit distinctive imaging characteristics that aid in their diagnosis and differentiation from other more aggressive pathologies. We will explore the radiological features of spinal hemangiomas, such as the characteristic corduroy cloth or polka dot appearance on imaging, as well as discuss the significance of these findings in patient management. Spinal metastases are a frequent manifestation of advanced malignancies, significantly impacting patient quality of life and survival. Radiologic imaging plays an indispensable role in the detection, characterization, and monitoring of spinal metastases. We will explore the typical imaging features and patterns of spinal metastases, highlighting the importance of different imaging modalities in their management and assessing treatment responses. Spinal tuberculosis, often referred to as Pott's disease, is a devastating form of extrapulmonary tuberculosis that primarily affects the spinal column. Radiographic imaging, including radiography and MRI, plays a crucial role in the diagnosis and monitoring of this condition. We will discuss the various imaging findings associated with spinal tuberculosis, such as vertebral collapse, paraspinal abscesses, and spinal cord compression. Additionally, we will touch upon the role of image-guided interventions in managing complicated cases. Artificial disc replacement, ADR, has emerged as an alternative surgical option for the treatment of degenerative disc disease in selected patients. Through this topic, we will delve into the indications, contraindications, surgical techniques, and various implant designs employed in ADR. Furthermore, we will highlight the role of preoperative imaging, including dynamic radiography and MRI, in patient selection and postoperative assessment of ADR. Spinal cord stimulator, SCS, placement is a minimally invasive procedure that offers potential pain relief for patients suffering from chronic pain refractory to conservative management. We will discuss the principles of SCS, including patient selection, implantation technique, and potential complications. Radiologists play a crucial role in preoperative imaging planning, intraoperative fluoroscopic guidance, and postoperative evaluation of the SCS system's position and lead migration. Radiology plays a crucial role in managing spinal conditions, offering various imaging techniques and interventions. We have covered 12 important topics, discussing in detail the radiological features, clinical implications, and treatment considerations for each. By mastering spinal radiology, medical students can become valuable contributors in the multidisciplinary care of patients with spinal pathologies.